Do you know that over 500 million people worldwide live with diabetes mellitus and most of them don't even know it? It's called the silent killer because it slowly damages your heart, eyes, kidneys, and nerves without warning. But what exactly is diabetes? Why does it happen? And can it be prevented or even reversed? Let's find out in this complete guide to diabetes mellitus. Diabetes mellitus is a metabolic disorder that affects how your body uses glucose, the main source of energy. Normally, when you eat, your blood sugar rises. The pancreas releases a hormone called insulin, which helps your cells absorb glucose. But in diabetes, this process doesn't work properly either. Your body doesn't produce enough insulin, or your body can't use insulin effectively. This is called insulin resistance. The result? Glucose stays in your blood, leading to high blood sugar, or hyperglycemia. There are three main types of diabetes. Type 1 diabetes usually appears in children or young adults. The immune system attacks and destroys insulin-producing cells in the pancreas. People with type 1 diabetes need daily insulin injections to survive. Type 2 diabetes, the most common type, 90% of all cases. The body produces insulin, but the cells don't respond well to it. It develops slowly, often due to unhealthy lifestyle, obesity, and genetics. Type 2 can often be managed and even reversed with diet, exercise, and medication. Gestational diabetes occurs during pregnancy. Hormonal changes make the body less responsive to insulin. It usually disappears after childbirth but increases the mother's risk of developing type 2 later. Diabetes symptoms can develop slowly. That's why it often goes unnoticed. Here are the classic signs. Excessive thirst, polydipsia. Frequent urination, polyuria. Extreme hunger, polyphagia. Unexplained weight loss, fatigue, blurred vision. Slow healing wounds, tingling, or numbness in hands and feet. If you notice these symptoms, get your blood sugar checked immediately. Doctors diagnose diabetes through blood tests such as fasting blood glucose, greater than 126 milligrams DL, random blood glucose, greater than 200 milligrams DL, with symptoms HbA1c test, 6.5%. This shows your average sugar levels over 3 months. Oral glucose tolerance test, OGTT, after drinking a glucose solution. Early diagnosis is the key to preventing complications. Managing diabetes isn't just about taking medicine, it's about changing your lifestyle. Here's how you can control it effectively. 1. Diet, medical nutrition therapy. Focus on low glycemic foods like whole grains, vegetables, lean proteins, and fruits in moderation. Avoid sugary drinks, white bread, and processed foods. Eat small, frequent meals to keep sugar levels stable. 2. Exercise at least 30 minutes daily. Brisk walking, swimming, cycling. Exercise helps your body use insulin better. 3. Medication oral drugs like metformin help reduce insulin resistance. Insulin therapy is essential for type 1 and some type 2 cases. 4. Monitoring. Regularly check your blood glucose. Track your HbA1c every 3 to 6 months. Watch your blood pressure and cholesterol too. Managing diabetes is a daily commitment, but it's completely possible to live a healthy, normal life. If diabetes remains uncontrolled, it can damage multiple organs over time. Heart disease and stroke, kidney failure, eye damage, retinopathy, nerve damage, neuropathy. Foot ulcers that can lead to amputation. That's why consistent management and checkups are so critical. The good news? Type 2 diabetes is largely preventable. You can cut your risk by maintaining a healthy weight, eating balanced meals, staying physically active, managing stress, getting enough sleep. Small daily habits can make a big difference in your blood sugar and long-term health. Diabetes doesn't have to control your life. You can control it. Get regular screenings, stay informed, and make health your top priority. If you found this video helpful, hit the like button, subscribe, and share it with someone who might need it. Together, let's raise awareness, because early action saves lives.